behavioral problems or behavioral disorders in children, and when the children cannot adjust the complex environment and they are showing different types of behaviors in the society and to the family, that is called as behavioral disorders. And coming to the causes of this, and faulty parental attitude, inadequate family environment, and mentally and physically sick or handicapped conditions, influence of social relationships, and influence of mass media. There are four types of behavioral disorders or problems in the children. They are dividing like this. Here, emotional deprivations are problems, physical deprivations are physical problems, social problems, and other problems of the baby. And coming to the emotional deprivations for this, temper tantrum, breath holding spells, jealousy, insomnia, nightmares or night terrors, somnolence, and masturbation or homosexuality and bruxism. And physical problems are physical deprivations. In this comes under the enuresis or bedwetting, encoporesis, tics, nail biting, pica, thumb sucking, attention deficit hyperactivity disorder, ADHD. Coming to the social deprivations, juvenile delinquency, school phobia, stealing, repeated failures, lying, and aggressiveness or destructiveness behavior. Coming to the other forms, sibling rivalry and speech disorders. Coming to the temper tantrum under emotional deprivations, and temper tantrum is a sudden outburst or violent display anger, frustration, and bad temper as physical aggression or resistance such as rigid body, biting, kicking, throwing objects, hitting, crying, rolling on floor, screaming loudly, and banging limbs and head. These all are the symptoms we are showing in this picture. Loud crying and severe crying will be there, rolling on the floor and head banging, beating, throwing, and everything the children will do for the temper tantrum. And coming to the management for this temper tantrum, you never give punishments to the children and don't scold the children. So you have to explain them in smooth manner and divert the child for the play therapy especially. And coming to the in general and parents advice to set a good example to the child and pay attention to the child, spend quality time with the children and have open communication with the children. And during temper tantrum, what is our treatment? Parents to ignore the child, and once child is calm, tell child that such behavior is not acceptable and it is not good for this family. Near beat or threaten child, and don't punish the child, explain acceptable manner, and never compare the child with other children. Coming to the breath holding spells, the children they are stopping their breathing up to more than 1 minute or 1 minute. It is called as the breath holding spells. Maybe it leads to cyanotic spells and acyanotic spells or palate spells. Like this, the children they will stop after temper tantrum. If nobody is keeping concentration upon them, maybe they will start their breathing up to 1 minute. Maybe it leads to spells. Spells leads to fainting, stiffness, too fast or too hard breathing. Okay, and also bluish discoloration of the skin also will be there, and jealousy feeling. This all everyone is having the jealousy feeling from childhood. They are developing the jealousy. This is also one of the emotional problem. And coming to the management for this, for all behavioral problems, you never punish the child. You have to explain them in understanding manner and try to provide everything for the children and don't show any partiality especially. And coming to the sleep disorders, somniloquy, it is a sleep talking. And they are talking irregular words, and in while sleeping also they are keeping some expressions and they are laughing also sometimes. And management is before sleeping, you don't show any adventure movies or any type of video games, and also any stories, creativity stories, and don't tell creativity and life stories to the children. Somnambulism, it is a sleepwalking. Most of the children they also having this type of habit. While walking also they can open the doors and they can go for washrooms and they can able to clean it. And also some activities also they can do, that is like cooking, and sometimes homicides works also they can able to do, and some members they are trying to do driving also in these situations. And coming to the nightmares or night terrors, it is a fearful situations they are facing about the night, and they were thinking about somebody is there in their room and they don't want to sleep alone also. This situation is called as night terror and nightmares. Maybe bad dreams also they will get this situation. And coming to the management, never leave the child alone and try to sleep along with the child, and you have to face the situation to the child. Coming to insomnia, there is a lack of sleeping to the child is called as the insomnia. And coming to the masturbation, the children are playing a stimulation of the manipulation of one's own genitalia or others' genitalia. It is called as the masturbation. And homosexuality, it is the sexual attraction between the members of same sex or gender is called as the homosexuality. And coming to the bruxism, there is the excessive gritting of the teeth is called as the bruxism. When the children they will get emotional feelings, excessive laughing and excessive anger, they are keeping this type of bruxism symptoms. Coming to the physical problems of the newborn baby, there is a enuresis. Most of the children they are passing the urine on the bed. Up to the 5 years, 6 years of their life also, it is you have to modify the child behavior and you have to practice the child for the bladder controlling capacity, and while sleeping you restrict the fluids and same sleeping patterns they have to maintain. While they are going for the sleeping, you have to make them to pass urine and you have to follow the same timing pattern for the urination for the children before sleeping. And before sleeping you don't show any adventure movies and don't tell any horror stories. Maybe it leads to they will get fear and they are having fear to call you while they want to go for washrooms and all. Coming to the tics, it is a non-voluntary body movements or vocal sound made repeatedly or suddenly. It is called as the tics. In these tics, the children are keeping different mannerisms and maybe for example blinking the eyes and smacking the nose and smacking the lips also, and always they are rotating their mouth and clearance of the throat, shoulder girdling and also neck clearing and everything they will do different manners. That is called as the tics. Coming to the nail biting, this habit mostly preschoolers they are starting this habit while they are getting tensions and stress, and this situations they develop this type of nail biting habit. This is also a very bad habit they are developing here. Coming to the pica, it is the eating substances other than food. Maybe they are eating clay, sand, plasters and from walls, and this picture is showing the newborn babies and infant baby mostly while playing they are eating uneatable substances, especially mud, small rocks and sometimes paintings and chalk pieces, slate pencils, and maybe they are eating something painting also on the walls something while they are playing. This is called as the pica. Most of the children they are having the habit of thumb sucking while they are feeling a loneliness and insecurity, and they are feeling hungry. They are starting this thumb sucking, and few years they are continuing this thumb sucking in their life. And coming to the ADHD, attention deficit hyperactivity disorder leads to lack of attention, lack of interest to the external environment, and while anyone is saying something they don't want to listen that situation and they don't want to face that situation. That is called as the lack of attention. And coming to the management for this, you have to give the psychological support and psychotherapy you have to provide them, and mood changes also you have to start for this. And coming to the juvenile delinquency, the juvenile delinquency is defined as an individual under the age of 16 who fails to evade the laws. Means they are doing the antisocial behavior against the society. They are doing the rapes, murders, and they are having the habit of smoking and alcoholism, and their robberies also they are doing, and they become like a street roadies and they are mixing into the gangs. So what are the main causes for this? Ignore family, lack of supervision, and poor socio-economical status, broken families, divorced family, and nuclear family. So many reasons they are mixing into these type of groups, especially it is called as the juvenile delinquency. Coming to the school phobia, most of the children they don't want to go for the schools, and they are saying different types of reasons for this to avoid the school going. That is called as the school phobia. Especially maybe there is a no proper culture, means about the school environment, and no proper friends also maybe one of the reason, and they want to enjoy in their homes also reason. They don't want to go for the school. They are having the phobia about the school going. Coming to the speech disorders and stuttering or stammering, It is fluency disorders beginning between 3 to 5 years, probably due to inability to adjust with the stress. And some children, they can't pronounce properly some letters like A, D something letters, and also some members articulation problem also will be there, starting problem, and sentence pronunciation problem also is there. That is called as the stuttering and stammering problems for the children. For this type of children, they have to provide the speech therapy, behavioral modification and relaxation therapy. They have to provide for the speech therapy, and help the breath controlling exercises also they have to start. These are the main behavioral disorders for the children's.